In terms of Heritage Valley Health System, we're a mid-sized healthcare organization in southwestern Pennsylvania. We have 3 hospitals. We have approximately 70 other satellite facilities, and we have thousands of medical devices and IoT devices spread throughout that environment. So that's an awful lot to try and get your arms around. So let's talk first about visibility, and let me give you a little history in terms of how this all started for us. As Tom mentioned, we were the victim of one of the most significant supply chain attacks at that time in 2017, the NotPetya global supply chain attack. And I know that a lot of organizations over the past year have also been impacted by SolarWinds and most recently Kaseya. Supply chain is unfortunately a very popular, a very effective means of attack of organizations. And just like everything else that we work with in terms of technology and cybersecurity, it's going to require a focused collaborative effort for us to start to improve our security posture together. But we were again a victim, and the NotPetya attack was not a ransomware attack. It was designed to be destructive. So a lot of people believe that it was ransomware. It was disguised as ransomware, but it was actually a destructive attack. And at that time in our world, we had Biomed with a very mature CMMS. It was very well managed. It was an accurate picture of the inventory of devices across the organization, and their status for preventive maintenance and so forth. But what was lacking was any information related to whether or not the device is connected to anything else, any attributes associated with that connectivity. That was a significant gap. So action items from post-attack assessment. We had a lot of assessments done, and one of the items that was brought to our attention was the need to identify a comprehensive medical device risk management program. So while we had, again, these pockets of information, we really didn't have an overarching program to manage the risk for those devices across the ecosystem. And, honestly, I'm sure many people have heard this before. You can't manage what you can't measure. It's all about accurate real-time visibility of your asset inventory. And that's where we started our journey. So we initially started to try to use the data from the CMMS and the IT asset inventories in our traditional vulnerability management solutions, the scan data. And we spent a couple months trying to cobble those together, and it was not very successful at all. There were too many disparities in the data sets. There were no common index values between those data sets. And at that point, we realized that we were going to need some assistance to try to get our arms around this challenge. And we assessed a number of solutions at that time. This was back in 2018, going into early 2019. And we did a few proof of concept evaluations. And we had some solutions that identified a large number of devices, but the accuracy of that identification in terms of those attributes, operating system, firmware, manufacturer, et cetera, were lacking. And when we decided to engage Medigate in a partnership, what we found was that the Medigate solution really exceeded our expectations in terms of this first step of the process to eliminate the physical inventory, build that dynamic digital inventory, and again, give us all of the attribution of those devices, not just what they are, but how they are functioning. As Tom mentioned, utilization management, how are they functioning? What are they communicating to across the network? And it started to build that foundation, if you will, that we could then step into an integration phase and begin to enrich that data. So the enrichment of that data was, again, key to beginning to do some basic controls. You have to get a better understanding of not just what the devices are, but what they're doing. And the accurate real-time inventory was key to that. So we have integrated right now with a number of our solutions across the security stack. We have integration with network access control and firewalls, as well as endpoint detection and response, vulnerability management, and Active Directory within our environment. And all of those integrations give you now actionable data that you can use to begin to remediate a number of different types of scenarios. So as pictured here, one of the most significant pieces of information that we gained from this platform is a dynamic risk score associated with each individual asset. And again, I've said this before, this is a risk management program for us. It's not so much just security for the sake of security, but we're trying to assess the risk and then prioritize our actions based upon those highest risk areas. So the Medigate platform, with its data set, gives us a risk score along with insights into the vulnerabilities and threats, both with native to the Medigate platform as well as what we get from our vulnerability management system. All of that is correlated together, and then we can assess and prioritize what the potential threats would be to those devices. A key function is not just understanding the risk, but when you go to remediate it, what is the impact going to be? Are you going to hit the mark? And what we found was that the risk remediation simulation capability within the Medigate platform allows us to do that type of what-if planning before we make any changes at all at any layer. And that really gives us a better projection in terms of what our effectiveness is going to be, because we don't want to have to touch these devices multiple times. We want to try to assess the risk, address the risk, and move on to the next priority. So the real value of Medigate having access to all this information, as Tom said, is not just the fact that it's there and you can use it, but that it helps to build what your remediation instructions are going to be. What do you need to communicate to the firewall? What do you need to communicate to network access control? And all of that, obviously, with an audit trail that gives us and others that are assessing us on an ongoing basis confidence in the process that we use to manage risk and the controls that we are implementing. When you look at the checkpoint and Medigate integration slide here, it really, you could do all this manually. And anybody that's been in the business, going back to, again, legacy types of segmentation efforts, because you can't put segmentation agents on devices. The OEMs have them locked down. They will tell you that it'll be unsupported and all of these other restrictions. But what you gain with this direct integration is a greater value of your time and effort, because you're not constructing all of this manually, these object lists and these object definitions and what the ports and services are. The Medigate platform packages all that and makes that available to the checkpoint platform, that then you can very easily build your rule sets within the policies across the organization. And again, that can be, between devices, on the same network, across networks, between locations. As you see in this diagram, you really have the ability to control all the way across your ecosystem.